Well, I'm Dr. Jim Del Rosso, a dermatologist in Las Vegas, Nevada, where I practice clinical dermatology and am involved in directing a research center where I also serve as a principal investigator. So have a lot of hands-on experience in dealing directly with patients in clinical practice, but also on the research side and looking at information that we get when drugs get approved. And we've had really a barrage of new approvals, and some of them have been Janus kinase inhibitors, two oral Janus kinase inhibitors for atopic dermatitis, upadacitinib and abrocitinib. And then we have topical ruxolitinib, which is a Janus kinase inhibitor that's approved for topical application of atopic dermatitis. So first of all, why do we even need these drugs? Well, even with the best agents we have, and we had major advances, obviously, with the monoclonal antibodies, there are still some patients where we might need to get greater improvement. They're still having difficulty with some of the symptoms and the problems with atopic dermatitis where they want more. And with Janus kinase inhibitors, the oral agents, there's certainly some improvement over what you can typically get with a monoclonal antibody, though the monoclonal antibodies are known to work very well. But there's some baggage in terms of not only the black box warnings in general, but laboratory tests that you have to get. The advantage of having a topical Janus kinase inhibitor, even though unfortunately, I say unfortunately, the black box warnings are there, those events typically did not occur. Would very very unlikely to occur with the topical because of the amount of absorption, the limited absorption you get, and you're applying to a relatively low body surface area. So we have a lot of data to show that based on maximum use. But the advantage is with something like topical ruxolitinib, which is FDA approved in patients with atopic dermatitis, uh, you have the advantage of being able to apply it, get very high concentrations in the skin with limited systemic exposure, utilizing on the face, sensitive skin areas, and in my estimation, certainly giving us quick and better results than we typically had with nonsteroidal agents. So I really think there's a very good safety zone in terms of when you use a topical Janus kinase inhibitor like ruxolitinib for atopic dermatitis, and a lot of data to support that.